Please be sure to like, share, and subscribe.
The thought of an EMS provider being charged criminally with something really has only been within the last couple of years.
And covering up a mistake with another mistake doesn't do anything.
You are listening to EMS with your hosts, Eric Axine and Matt Ball.
Well,
You know, the blue in this matches my...
it does.
My
Your top.
My top.
Your
Thank
top.
you. Thank you, my top.
Your blouse.
That's what women call their shirts, sir.
Well, what are your sweatshirt? Your quarter zip. That's what it's called, quarter zip.
That's too technical for me. I was
What do
working
you
out.
call it?
Well,
It's not a shirt.
I
That
call
would be
this a
a
sweatshirt.
Okay, yeah, sweatshirt or
Sweatshirt.
quarter zip.
No.
Do
never
you have
used
a
that
hard
word.
time getting
used-
shirts to fit your gigantic arms in?
No, I do not.
Man, you're so lucky.
I was talking to my workout partner this morning, and he's not a doctor. No medical bone in his body.
Right. Well, he's got medical bones in his body.
He truly does. And actually, it's about a bone. We were talking about something, and I gave him the technical term for this, the zygomatic arch,
Yeah.
in the face. And no, that's a face bone.
The phalanges. No, those are finger bones. That's funny. The zygomatic arch.
That's kind of, when we do our stuff, we, teaching people stuff, making things simple, right? Yeah. So we had some interesting stuff happen in the news again.
Yes, another, the paramedic this time, which seems like most of the time it's a paramedic because it's related to medications, but another pre-hospital provider has been charged with manslaughter as of right now. This is out of Sioux City, Iowa.
Last week, Friday, I think, right?
Yes. Now, this incident actually happened in August of 2023,
right.
So it's been a little over a year.
But is with the indictment or
whatever they call it.
Whatever they call it.
Yeah.
Legalese happened Friday.
Yeah, they're legal zygomatic arches.
That's what I'm talking about.
Yeah, everybody's got their legalese. So yeah, this
They made a decision.
correct. Happened a year and a half ago, roughly. The incident. And this is all over social media right now. All of the EMS influencers and everybody's kind of talking about this. And so I thought it was good that we discuss this because, like we were talking and kind of prepping for this podcast, that the thought of an EMS provider being charged criminally with something really has only been within the last couple of years. I mean, you go back 10 years ago, I never heard of a...
We never made mistakes back then.
Of course.
We were perfect back then.
Everybody was perfect back then. These Gen Zers or whatever, they need to... No, I'm just kidding.
Seriously,
Millennials.
though, why are we seeing it more now? I mean...
What do you think
I
the
think it was
reasons?
happening
Yes.
I think it was still happening.
Everybody makes mistakes.
It could be happening more frequently now. It could be happening less frequently. But I think there's certainly more of a limelight on us with recent controversies, looking in the pre-hospital environment. There's some pretty notable cases that have occurred.
Yep.
So people are looking at us more, maybe, especially within the healthcare industry. I spoke on this at EMS World. I mean, the pre-hospital environment now is really becoming more part of the whole healthcare continuum, where it used to be what happened before the ambulance bay doors didn't really matter.
You're an ambulance driver.
It
taxi,
does.
Yeah.
It matters more now, so I think there's more accountability there. I also think that or like you've actually said, I think you told me recently your protocol book went from 50 pages to
over 200.
5,000 pages. I'm kidding.
It feels like that.
I guess my point is that I think we're held accountable more. The limelight's on us more, and we're doing more too.
Yes.
Than we used to in the past. Some more of the more progressive agencies are pushing meds that are. They're deadly. They're the big guns.
Well, we're going to get to that point.
Yeah.
That very point. But also, I think body cameras are another, and all the security cameras that people have.
Yeah.
So I think, obviously, like you said, there's a lot of factors coming into why are EMS providers being charged.
Right.
All of those that you said. But back to the point of we're doing a lot more. If you go back 10, 15, like when I first started 20 years ago, in my department, we did not have RSI. We did not carry paralytics. We have been doing it for a while. It's probably been 15 plus years that we have had the ability to do that. But I think that more and more, if we're going, expanding out across the country, more and more departments, more and more private ambulance companies, services, whatever you want to call them, are getting more and more, I wouldn't say dangerous medications, but they're getting more their protocols are becoming more complicated.
Yeah.
Their treatments are becoming more complicated.
The impact we can have on human life and patient care is
Yes.
getting more powerful, I would say.
For sure.
It's powerful to transport somebody, but during that transport now, you're delivering these meds, you're securing the airway,
Yes.
it's
And when you think, and we've talked about this, one-on-one, we were talking about it this morning. When you think about, you got your undergrad 4 years, and we did a whole podcast on med school. Then you did med school for 4 years. Then you did residency for 3 or 4 years. I mean, you're talking about a decade of education.
It's like 50 years of schooling.
Yeah. I mean, but literally,
No,
I
it
mean,
is a
you
lot.
are a
Years,
decade,
a decade
of education. My paramedic school was 6 months, and 3 of that was clinical time. It was really 3 months, 4 maybe of classroom with clinicals, and then I got out, and then it was a month riding out with another paramedic, and then it's like, here you go. And we are asked, in some situations, we are asked to do the same thing that you do as a doctor.
Yeah.
We're asked to identify and treat the same things you are in the ED with all the resources that you have at your disposal.
Well, a lot of this we'll talk about it more later, but that's what makes education even more important in the pre-hospital environment.
Right.
So tell us the story
Of Sioux
of
City.
what happened. Yeah, there are lots of stories we could tell,
Right.
but this most recent story for folks that don't know.
Yeah, and again, I think it's good to preface it with, neither one of us were there. We're not on this call, obviously. Nobody was besides the people that are writing about it. All the articles and things that I've heard is paramedic, Sioux City Fire Department paramedic, called out by PD, I believe.
46-year-old experienced.
Yeah, it sounded like it. She'd been with the department for a while. Went on a 26-year-old patient, I believe
That's
it was.
correct. It was 26.
And they were there. They were trying to move the patient over to the cot. He was in an emotional state of some kind. I haven't read anything about alcohol or drugs, or I have no idea what.
Non-cooperative,
Yes.
poor behavior, whatever.
And
non-compliant.
everything I've read said they couldn't get him on the cot. And so whether that was he was physically fighting them to get on the cot or just refusing to get on the cot, I don't know.
I could be wrong, but I think PD was on scene first.
They may have been. I don't know.
I thought I read that. I could be wrong, so
yeah,
read
I
it for
don't
yourself, but I thought they were there first.
And typically in most agencies, if you have a patient that's uncooperative, PD's usually on scene to secure the scene before we get there. That's why they call us the second responders, but we're just not bullet sponges. So anyway, we'll debate that later. No, I'm just kidding. I love my PD brothers. But so she gets on scene or they get on scene. Patient's being uncooperative. Again, don't know if he's being physically uncooperative or just whatever. She decides she's going to give him ketamine, which we did a whole podcast on ketamine. So, and a lot of these cases, if you look at them, a lot of these cases, ketamine is involved. And we're going to talk about medication, but we don't want to specifically talk about ketamine.
That's not the focus of this podcast, but we could touch some of the high
It's a
points
factor,
maybe.
but not the focus, right? So she intends to give him ketamine, which is my protocol is the same way. If somebody's having a psychiatric emergency, being difficult, I am injection of ketamine.
Which is an appropriate use of that medication. It can help in some situations. But anyway, keep going. Yeah.
No, so gives him the medication. Apparently, she doesn't give the right medication. She actually ends up giving rocuronium by accident.
Which is a
IM
paralytic.
injection, which is a paralytic, right? For our EMTs or whatever. Students that don't understand, that is a paralytic, so not a sedative. Long-acting, almost an hour, 50 minutes to an hour. So that's going to shut down your patient's respiratory drive. The patient is not going to be able to voluntarily breathe on their own anymore, so that's a bad thing, correct?
Yes, you're correct. I didn't know it was that long ago. We'd have to look it up.
The stuff that I've said, so sucks typically is we carry sucks and we carry rock. So sucks is a very short-acting, 10 to 50. Again, as we all know, it depends a lot on the patient, right, and what's going on.
Yeah, there are different classes of paralytics.
Correct.
And they're in 2 different camps. And we don't need to get into the pharmacokinetics on this, but
Vec and rock are the 2 long-acting, which is why typically Rock has less contraindications than Sucks does.
Yeah.
And
storage is easier.
Storage is easier. Yeah, there's some benefits to Sucks, which is the short acting, that if you can't get the tube, then the patient's going to start breathing on their own again. But again, right.
And one of the things too with some of these meds is that they're reversal agents, but we don't carry them. But
well, yeah, I know my agency doesn't. Maybe there's agencies, maybe some critical care flight folks that carry.
The ER will have them
for sure.
Yeah,
yes,
yeah.
But anyway, so she intends to give the patient ketamine. Mm-hmm. She accidentally gives the patient rock. Mm-hmm. Apparently, from what I've read, does not realize that she gave it until she went to give a second dose.
And I think it was where this was occurring was there was a distance between the ambulance and where the point of care was, and she's going back and forth, back and forth.
Correct.
Which is a factor, I think.
That's a factor as well. So realizes when she goes to drop the second dose that, I gave rock. And this is where we all make mistakes, right? Now,
Well, I do. I didn't know you did. It's very brave of you to confess
come on,
this.
Bro.
We all make mistakes.
So she realizes that and again, none of us were there, but what's being reported is she doesn't tell anyone on scene that she has done this. Again, I'm not accusing her innocent until proven guilty. I give our first responders all the grace and credit in the world until facts are come out, and I'm not going to take a news article that I read as fact.
Yeah.
So we don't know what actually happened, but what is being reported is that the other providers on scene were not informed that the patient was given rock. From what I've read is that she was the lead paramedic or the head paramedic. Wow. Don't know if there was other paramedics on scene or if everybody else was maybe just don't know any of those factors.
Yeah.
But they, from what I read, were not informed of what had happened. Yeah. And allegedly the patient started complaining of trouble breathing, which makes sense. Yeah. And then I'm assuming at some point, from what I read, he went into cardiac arrest. They started performing CPR.
It's funny what happens to the heart when it doesn't get oxygen.
Yeah, and more importantly, the brain.
Yeah, the brain will go first.
Yeah.
The heart's the second most hungry. Well, that's not true. I think the kidney's in there. But certainly the heart gets pretty angry when it doesn't get oxygen, given unperfusing rhythms. Yeah.
Right. And what, like we've talked about, is that, we give epi and all these meds to get the heart back, but really what we're trying to save is the brain, right?
Absolutely right.
And so that was the problem. So anyway, don't know if he was intubated, if the patient was intubated during the code. Don't know any of that information, but apparently they worked the cardiac arrest, transported the patient. Again, nobody else, from what I've read, knew that rock had been given. And then when they got to the ER is when the paramedic told the ER physician, hey, this is what I gave by accident. And from what I understand, the patient about 48 hours later was finally, I don't know if I'm assuming he must have got a pulse back at some point because he was young. He was 26. So the heart started ticking again, but the brain went without oxygen for too long. Excuse me, 48 hours.
Yeah, every minute without oxygen, you lose 7.5 miles of fiber.
Myelinated fiber, what do you call it?
And if you lose what's called a penumbra, which is like the area of ischemia the tissue that's not getting blood, the bigger that area is, the more profound the swelling, which has its own, the pathophysiology. It's just a vortex of death with the brain. Yeah, it's not good.
Yeah, the brain does not do well, like you said, without glucose and oxygen. And so anyway, so then the patient passed away. Yep. And then, like I say, this happened in August of 23. And then so she...
And the autopsy, too, confirmed everything. It was exactly ischemic damage globally, and then by rocuronium.
Yeah. So charges, manslaughter charges have been filed against this paramedic. And so I think that if there's new providers, if there's young providers or people that are in EMT school and paramedic school and they keep seeing these cases maybe every 6 months to a year, they're like, oh my gosh, I'm scared. I could get charged with negligent homicide. There was a nurse a couple years ago from Tennessee, Redonda Vaught, I believe was her name, if I remember correctly, who
Vanderbilt.
was from Vanderbilt, that was charged in that case, a medication error again. So I think that the first thing that's important to talk about is all of these cases that we have seen pre-hospitally where charges have been filed against the providers. Whether it was, in almost every case that I can remember, there was some error in the 5 rights. There was some error of right patient, right dose, I know was a factor in one. Right route, right medication.
Yep.
Obviously, that was the issue here, is that the wrong medication was given, right time, all of those things. And so that, if you are a provider and you're scared about these charges, like, oh my gosh, I could make an honest mistake. We all make mistakes, right? You're an ER doctor. You've been doing this a long time.
You brought up something that's kind of interesting. I'm glad you brought up the 5 rights, obviously, but you said a new person might be afraid.
Yes.
And I think you should be. Let me explain it.
A healthy fear.
A healthy fear. So when I learned my first time being taught at a gun range and handling a firearm, I told the individual, he actually is like a private security for folks. He's very, very comfortable with his guns.
Yeah.
I told him, I said, man, this is scary. I feel nervous. And, and he goes, that's good. I'm glad that you feel that way. You should feel that way. And I think we should feel that way in a respectful, in a way that we can still function, is that to be aware of the fact that these medications that we're pushing and learning how to handle have complications, and we should be aware of them and be prepared for them.
Right.
The stakes are high. You are taking somebody's life in your hands when you choose to take an airway or give a medication like this. These are very powerful medications. This is not vitamin C. No. This is a very, very powerful medication, has dramatic effects on our body's physiology.
Yes.
And creates the potential for some very, very bad disease, which obviously manifests in death in this patient.
Yeah.
The other thing with fear, I will say too, though, when I played football, our coach taught us you cannot play afraid of getting hit. You play afraid of getting hit, you're going to get hurt. So we have to be able to find a way to walk into these situations with a positive mindset. We actually talked about this in a recent lecture, is being prepared and in a way where we're confident walking in there with our training. But we also have the safeguards of people around us, a team, but we can't walk in afraid of making a mistake. Because